This session is intended to be informational and educational and does not constitute medical or health advice, diagnosis, or treatment. You should always seek the advice of a physician or other qualified health care provider for diagnosis and treatment of your specific medical needs. For questions regarding personal health or medical conditions, and before beginning or changing any treatment, activity, program, or dietary plan. AARP is not responsible for the consequences of any decisions or actions taken in reliance upon or as a result of the information provided during this event. Also, for everyone who has registered for this workshop, you will get a follow-up email with a link to the resources that will be shared today, along with a survey. So it's wonderful to see you all. We have volunteer Sarita Cardozo, who is managing the chat today. Sarita, where are people calling in from?
Well, Sophie, we have at least one person from Idaho, and not everyone has put in where they're coming from, but we have Earl Fong from San Francisco, and one person at least from Benicia. Oh, and there's one from Georgia. Oh, now they're coming in. So we have Nancy from Georgia. We have Marcella from South Carolina and Mary from the Bay Area. So we have people from all over.
Wonderful.
Including Florida, yes.
My goodness. Well, it's my pleasure to welcome you all and very pleased to bring back our amazing team from last week. But let me start with introducing our guest host, Flora Haas. Flora serves on AARP California's Executive Council. She is a retired she's a retired nurse, and she's also a tireless volunteer for many organizations and has a passion for healthcare, health equity, and emergency preparedness. Welcome, Flora.
Thank you, Sophie, and good morning to everybody. I'm very glad to be here. You know, the concept of being able to seek out the answers to your questions on health do not escape those of us that have had experience in the healthcare. Just recently, I had a family member who will be undergoing a T-cell transplant. I say that slowly because I still know so very little about it, but because of Lisa's work last week and what I plan to absorb this week, I'm going to know where to go to get more information and keep myself calm while they're going through this. Back in May of this past year, AARP Bulletin put out an article called Health Research Safety Tips. They cited in this article that almost 60% of all Americans, myself included, go online to get medical questions answered. And 80%, 4 out of 5 of us, are likely to research medical recommendations even after a doctor's appointment. Educating oneself about an illness, a medication, or just an odd-looking something, and we've all had them, can be beneficial. But there is a dark side to doing your own health research, hence the reason we're here today. One can be swayed one way of thinking or another and become cynical or distrustful. I'm excited today to be able to share our expert with all of you. Lise M from PlaneTree Health Library. Welcome, Lise. And I want to give a little shout out to her extensive bio, because one of the things Lise taught us last time was that we need to know the credibility of people that are speaking to us. And so here is her credibility. Lise began teaching online search skills in 1982, a long time ago, helping online researchers to find the information they needed, and has been a major focus of her career. In the past 4 decades, she has worked for colleges, universities, for health research organizations, and for teaching hospitals. Currently, she is the executive director for the PlaneTree Health Library, a public, nonprofit, online patient and consumer health library based in San Jose, California, with a specialized collection on aging well and other later life concerns, which is why we're all here. Her experience fits perfectly with its mission to guide people to trustworthy health information, again, credible, so they can advocate for better health care for themselves, their families, and their communities. Lise is certified as a consumer health information specialist with the Medical Library Association and has recently completed the World Health Organization's infodemic management training. That was a new word for me, Lise. Welcome.
Thank you so much for that wonderful welcome, Flora, and for to Sophie and to Sarita and all the folks who put on these Zoom programs. I want to give a special shout out to all the work that they do to do such a fabulous professional job of these slideshows. So I'm going to share my screen. Let me just get that up and ready for you. And I really do appreciate Flora's comment about how essential it is to understand who's talking, where they're coming from, and what they're about. And that's actually most of what we're going to talk about this program. Last week's program, we introduced a number of different scenarios for seeking information because there's not a one-size-fits-all. We all have different purposes, different reasons why we're going online, different things we need to find. The one that I didn't cover in that presentation was if you're trying to follow up on, is there anything behind this surprising health news article I got, or this announcement that I heard, or this ad that came on the television. And so we're going to be talking a lot today about following up on that. But what I'm going to be telling you, or rather I should say, and what I'm going to be telling you, are librarian secrets. This is what we do when we do reference work, which is what we call, professionally we call, when someone comes to us with a question and says, I need to find information on blah, 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 or I found this, can I believe it? Is that kind of critical thinking and analysis tools that we as librarians use that truly anybody can use. So I hope to give you the tools for your toolkit to be able to do this. So let me just bring up my screen and I will start play. There we go. And let me just minimize. Let me go back one. Actually, you saw the title screen. You don't need that. Need to find where in this I need to make my screen go away. There, I'll put it up there. All right. So as Flora mentioned, PlaneTree Health Library is an online library of curated links. Our librarian staff have chosen these links to other resources. So just like librarians choose books to put on their shelves, we choose online sites to link to our work, to our web pages. And the reason we do this is to help people advocate for themselves. One of the most powerful tools, actually being informed, is one of the most influential things to get a positive outcome from whatever health problem that you have health issue you might be dealing with. It's also, I think, important to point out that we're totally independent. What that means is that there's no financial incentive or commercial involvement with any other healthcare institution. So we're not sponsored by a healthcare system. We're not part of the agencies in our county, though we're affiliated with them. We're not actually under their financial aegis. So you can trust that we're focusing on what you need and not trying to promote or advertise or push anyone else's agenda. And as I say, PlaneTree Health Library actually started in 1989. So we've been around for a long time. We've seen a lot of changes in the information landscape. And this is me. And if you want to take notes, there's the email address you can have to reach me. You're welcome to address questions or concerns or just anything you want to ask out after this program. Why are we doing this program? What's our incentive here? And let me just quickly check. Boy, I'm just going to ignore that. Sorry. And back to why are we doing this program? As I mentioned, being able to find accurate and relevant information is one of the most powerful tools for good health outcome. These days, unlike when PlaneTree started, it's very easy to find health information, but finding accurate and trustworthy health information is a lot harder. And a great deal of the online health information we find is incomplete inaccurate, or biased. And that's not even considering the intentional disinformation that's out there. So we have to be really critical and think very carefully about what we choose to believe or to accept. One of the things I think is people don't realize is where we go to get news about new health developments or to get answers to our health-related questions. And where we go determines what we can do next in many different ways. Where we, I really am going to have to make this go away. There we are. Where we find information can decide for us just how much we can find and whether we can fact check it. You know, if you're watching the news on TV or YouTube, listening to the news on radio, in both of those cases, we're getting an oral input. We're hearing the information. We might be seeing a flash of something on the screen, but it's a little harder to remember. And how is that thing spelled? And what is it they're talking about exactly? It's actually much easier to fact check later if you're getting it in print, because you've got words to use to follow up, to do further searches and further detection. I want to make that point, that reading the news, whether it's print or online, is actually a little easier to follow up on, to fact check. But I also want to put a shout out to asking friends, family, or social media is one of the things we all do. And we need to be a little bit critical about our friends and where do they get information for. And we also ask the experts. These are all ways that we find out our news. And I'm not saying anyone is better than the other, but finding it in print makes it easier to fact check, is the point I wanted to make there. So, and why do we do that? Well, it's really always important. I won't go into more details, but I think you all can pretty much grasp that idea. But I really want to emphasize it is so very important these days. And what I have here on the left side of the screen is the box we have of links on our website to other fact-checking sources that are out there. You'll find this and many other resources I'm going to be talking about today at this URL. And let me just bring up the chat. And I'm going to also put it in the chat here for you guys. There we go. So there aren't that many URLs for this program to think of or remember, but I do want you to remember this one. We have 4 different linked web pages on aspects of evaluating health information. So what I'm going to be talking about today is also there. So you can sit back, relax, and listen, and don't have to feel like you have to take very careful notes. But one of the first things we want to do if you want to verify the accuracy of a story that you saw in the news or your friend told you about is to see, has anybody else already fact-checked it? There are a number of sources out there that do that. And the ones that we recommend, there's Snopes has a channel specifically for medicine. Snopes is a fact-checking service, but you don't have to wade through everything on Snopes. You can just look at the channel for medicine. And then for public policy, and especially for political claims, PolitiFact has their own health check. They don't call it a channel, but that's what it is. And that's in partnership with Kaiser Permanente. So they have experts to talk about actually the medical accuracy of some of the things that are claimed as political assertions. And as we're coming into election season, definitely put that one in your bookmarks. You may need to want to check that. Also, there's something called Ask SciCheck, which is yet another fact checker service called Fact Check. They have a section on science and public policy. And I wanted to include this one specifically from the University of Washington Health Library on fad diets, because there's so much misinformation out there about new diets and what they'll do for you or don't do for you. That's a really crucial source to have. So I wanted to make sure you saw those. You don't necessarily have to write down links for all of this. If you go to library.planetree-sv for Silicon Valley, .org/evaluating-health-info. You'll see this on our main homepage there. So that's where you'll get to that. We've actually broken up that section into a number of different, 3 different sections. So there's how to fact check health news, how to locate trustworthy resources, which covers some of what I talked about last week, and how to decipher medical research. Those of you who have been in scientific professions know that the scientific research literature isn't like news, or isn't like many of the other things we read. You don't start at the beginning and read to the end. You have to scan it very differently. And so we have a guide to how to read a research article and what to pay attention to on that section. And again, there's that URL again. If you want something less to write down, just our main homepage, planetree-sv.org, will get you to here, and from here you can get to this URL. We try to make it easy for you without having to go through too many different click-throughs. There is actually, and this is the first of the librarian tools, something that we call the do-it-yourself fact-checking sequence. So if nobody else has fact-checked something for you, you've tried those various resources and nobody's actually looked at that or done an analysis of that. First thing, of course, is check, has it been fact-checked already? Is there information about this specific issue in a trusted source? So, and that's a part of fact-checking. Then check the source. This is a crucial part. If the information is based on a study or a report, see if you can find the original, and does it actually say what is claimed? Oftentimes they don't. As a matter of fact, one of the rather frightening pieces of research to come out, this was before the pandemic, by the way, this was in 2015. Google did a survey of, back when they were segmenting their Google News service, of articles that came through Google News to see how many of them actually were accurate. And they found that close to 88% of those health news articles weren't accurate. There were different ways they were not inaccurate. Sometimes it was actual disinformation or misinformation or spin or bias, but 88%. So when journalists are writing about a piece of health news, or someone's putting together a press release about a new a service being available through a healthcare system, they often don't get it exactly right. So it's upon us to unfortunately try to track it down and say, what did the research actually say? Once you find the source, then check whether there are other studies that contradict it. Is there credible criticism? Are there later corrections or revisions? Science isn't static. You know, no one research study will prove something incontrovertibly. People are always coming back and checking. What about this? What about that? Or redoing the study. This is actually what makes for good science, is you redo the study to see if you got the same results. So it's also, especially if the research study was done a while back, keep looking to see, is there anything more recent? And if you get lost, if you hit a dead end, or if you find yourself going down an increasingly confusing rabbit hole, back up. You might even just close down your browser, take a deep breath, go drink a glass of water, and if you have time and want to continue going, start over, but knowing where you are now. So it's more of a cyclical process. It's never a go in, get out, and you're done. It's more up to you to decide when it's time to quit, when you've had enough. You've reached that tilt moment. So this is what I referred to earlier, was the spin by academic research on bias and spin in health news. They found at least 18 common types of spin in reporting, and I've narrowed it down into a smaller group, and almost 88%. And this is actually, the study itself is actually linked in this webpage where we mentioned this. So if you want to go read the research paper on that. The categories actually fall into more than, but basically what I think of as 4 categories. They were much more specific, but there was misleading reporting. And unfortunately, this is often the case. Journalists are trying to grab your eyeballs, trying to attract attention to their article. And so they're going to use hype or hyperbole or overly emotional language to catch your attention. And that can be very misleading. There's another more subtle type of misleading happening here, though. You almost never find reports, scientific research report, on negative results or on adverse events. You only see in print the good stuff. Hey, this works. Hey, this sort of works. You don't see, not really. As a matter of fact, I was shocked to see in an astrophysics journal at one point, it's the, I think, world's record shortest abstract of an article, of whole long title, does blah, 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 blah. And the abstract was probably not, end of story, which was very useful for astrophysics, but you don't see that when it comes to healthcare. So that's one of the ways that reporting could just be misleading. But the person writing the report can also mislead you by misinterpreting that report themselves. They may make claims that aren't statistically significant, or they use claims that something is safe or effective when we actually don't know that. Be very, very cautious about phrases like may help prevent. I would almost suggest that that's meaningless in this case. Or, and this is something that happens all the time, unfortunately, claims that A will cause B when there only seems to be some sort of correlation between A and B. Scientists will say, you know, causation is not, or correlation is not causation, which is their fancy way of saying, just because something tends to trend along with something doesn't mean that they actually cause each other. Healthcare is extremely complex. You're going to see a lot of trends that come with that may be a side effect, a related effect. There may be something else that's causing both of them, but the way that scientific experiments are focused on narrow aspects in order to be able to prove something scientifically, it's easy to assume that there's a cause between these two things. Another way that health news misinterprets things is by overgeneralizing. We see this more often. Overblown claims. Something is reported as will cure cancer when only one type of cancer is actually what's being studied. And it improves the outcomes. People tend to live longer with it, but it doesn't cure it. Or we see claims that something has been an effective treatment when the research hasn't been done on humans yet. It's only been done in animal studies or in vitro studies, you know, cells in a petri dish. Or if it has been studied on human beings, the study size is way too small to be actually statistically significant. Or it's not an inclusive study group. And this is a very serious issue for health research in this country, particularly because when we do clinical trials or when you do large scale research studies, it's very easy to actually miss certain groups of people who are less well represented. And COVID was a perfect example for us of just showing a real big spotlight on inequities in healthcare because those folks have not been able to be part of those research studies. Or there's kind of overgeneralization. There's an inaccurate extrapolation. For example, the research study looked at one particular chemical compound found in tomatoes, but what you see in the news report or the press releases, eat more tomatoes. Well, that's probably not a bad thing unless you have acid reflux, but it's really talking about only one chemical. And then, of course, there is, as we unfortunately note all too well, the explicit intent to mislead, to cause fear or anxiety, or to polarize people. So these are the ways that news reports, press releases, anything you see in the popular media can put a spin or a bias on research studies. And I think laying it out for you like this gives you an idea of what to be on the lookout for. So how do we do critical evaluation? Here's another acronym for you that librarians use. We call it SIFT. And the first part, the S stands for stop to check the information you're receiving against what you already know. Does it make sense given what you already know? But also check the emotional effect it's giving to you. And this goes to both the problem of disinformation trying to emotionally manipulate you, but also to the fact that journalists will blow up out of proportion the value of what they're trying to say. The I stands for investigate the source, and I'm going to be talking a little bit more about that. F stands for, again, find trusted coverage. And T stands for, again, trace any quotes or claims to the original context. So here's another acronym used. When we teach this at a college level, we use a lot of acronyms. So this is one of the ones that I found useful as a way to teach students how to do this. Okay, interrogating the information sources. There's a marvelous resource, I'll show you this, what it looks like in the next screen, called Trusted or Trash It. And it lists out a number of questions that we should ask. This is part of how we should interrogate each source of information we get, no matter what it was. It's a lot of the reporters' questions turned back on the reporters. You know, when was it written? When was the supporting research done? Especially in healthcare, if it's more than a couple years old, see if there's anything more recent. See if there's any reaction to when those articles first came out. Because as we know, science is constantly moving forward. Another set of questions are, who wrote it and who published it? I'm going to give you an example of how we do this in tracing down a particular story and claim through the literature, and some of the things that we'll look at as we do that. Another important question is, what is the source for your medical facts or the supporting studies? Where's the data coming from? And there are a whole number of questions, sub-questions under that, but that's the general category. And then another one that we tend to look at a little less often, it's often hidden, hard to find, who paid for the research? And this goes back to the point about there's often too little negative research reported. So when pharmaceutical companies do these huge studies to see whether a potential new drug is valid, they're not going to report in the literature when it fails. They're just not. And it takes a while before the adverse effects shows up until they actually get to the FDA approval process. So it's a human thing. We want to hide the fact that things don't work, but that's not really all that helpful when we're talking about protecting our health. So there's a couple places you can find it. This is the homepage for the Trusted or Trash It site. And they're talking here not just about health information, but all information. They have an interactive quiz that walks you through this process in these general 3 categories of how they say it. Who said it? When did they say it? How do they know? They also have the exact same quiz walking you through the steps in Spanish. Confiar o desconfiar. So for folks who are more comfortable in Spanish, that's a fabulous resource. We at PlaneTree Health Library have taken this model and refined it for specific questions you want to ask to interrogate your information when it comes to a health matter. And so that's part of our evaluating health information. We actually have a whole webpage for what we call Trust It or Trash It for health that you can find the link for there. So, and I love that phrase. You do trust it or trash it. And actually, for our purposes, we even encourage people to give it a +1, -1, or sometimes a +2 or 3, or total thumbs up or total thumbs down, and then add up your totals at the end of all this to say, well, do I believe it sort of, or do I really don't? I really don't believe it. Where does the balance come out? So that is one incredibly powerful tool. I want to come back to the point about, I said earlier, look for the original study or the research. How do we do that? Well, this is where finding out about it in print is tremendously powerful. Is you can use Google or another search engine to see if you can find that original study. The ways to do it are start out with an author's last name. If it's a distinctive last name, Smith or Johnson, forget it. But if it's a more distinctive one, and I say last name and not full name, because most of the time, scientific research is reported with first initials and just last name, or even last name, comma, initials. Include in the search string some keywords out of the title and some keywords from the journal name, or if you know where the research was done, if it's a press release from a university, for example, the research institution. And didn't actually show you this, but one of the things that's a very powerful tool that you can use with Google and most other search engines is, do you all know about putting things inside quotation marks? If you want 2 or more words to come in exact order, instead of just putting in the word, put them inside quotation marks because it narrows down your results much further. If you're looking for the Mayo Clinic, for example, if you type in double quote Mayo Clinic double quote, you get that organization. If you don't, you get the word clinic associated with mayonnaise or who knows what. So that's a very important technique to use when you're searching. And I have more to say if there are questions later about the ins and outs of using Google and other search engines to refine your search, but I want to come back to more of the critical analysis tools here. So going to that point of, does the research study, when you find it, does it really say that? Here's an example of why that's important, of how that's spun. This is something that came out about a link confirmed between baldness and heart disease. Well, okay, let's look at this and how the spin really comes into it. Link confirmed between baldness and heart disease. At least they don't say baldness causes heart disease. So they avoid that, but it's still, I would see that and I go immediately, oh my God, what about all of the folks I know who are losing their hair? And it doesn't really back off from that in the first sentence. Men who are losing the hair on the crowns of their heads have up to a 36% greater risk of experiencing heart problems, including heart attacks and bypass surgery. Again, that's going to grab my emotions and my fear. It tries to back off a little bit by saying men with a receding hairline are not at increased risk, but going bald at the crown should be placed with special attention. Here's how they didn't give you a link to the study, but here's how you find out what you need to know to find it. The study published in today's edition of the Archives of Internal Medicine. Aha, that's the journal name. So if I found it by searching, adding quote here, Archives of Internal Medicine, close quote, 2000, because it was January 23rd, so it said it came out today, that they said that's a date for when it happened. And I also use the phrase bald and heart attacks. And I did find the article. Notice though, it says it was updated 11 years later. Somebody came back to it and said, we need to change our language here because we didn't really do a good job. So this goes back to the, let's update that information question. But here's an example where they mention how you can actually go about finding the original study, which is what I was trying to prove here. And here's what the research study actually states. First, they said it was come out on January 23rd. It actually came out on January 24th. Well, oftentimes journal articles will land a day or so before their original publication date. But if it's more than a day or so, then what they were working from was not the actual research article, because they probably didn't see it. Probably what they saw was a press release about it. So that's definitely something to watch out for. Here's the author names, and as you see, it's initial, last name, initial, last name, etc. Oops, sorry. Let me back up. So what are some of the things we can look at to say, do we believe this? Well, it was a big enough group. It was over 19,000 people. It was a physician's health study, so it's only looking at physicians, people in that profession. So there might be something about working in healthcare as a physician that might incline you towards heart disease that is hidden in this study because they were only looking at male pattern baldness. And they specifically started saying, okay, did you start to have hair loss at age 45? And then 11 years later, did they have any coronary heart disease? Compared to those without any hair loss, those with male pattern baldness, specifically what they talked about earlier, where it's at the crown of the head, had a higher relative risk for cardiac events. And specifically, it was that crown of the head hair loss rather than a receding hairline or whatever. The highest relative risk was for men who already had hypertension or high cholesterol levels, who also had what they call vertex baldness. And their conclusion is it appears to be a marker for increased risk, especially among men with hypertension or high cholesterol levels. Reading this as a medical librarian, I would say the lesson here is if you have hypertension, if you have high cholesterol, and if you have hair loss across the crown of your head, get checked out. It doesn't say you're going to die of a heart attack. So I hope you see how the emotional manipulation that was done by the journalist to grab your eyeballs and get you all worked up about something actually isn't there in the article itself. All the while they're not actually being completely inaccurate, but they're manipulating you, which unfortunately is how journalists catch your eyes. Another thing that we recommend is searching laterally. And by that, we're looking at what do other sources have to say about the same topic. So after finding that article from the Archives of Internal Medicine from 20 plus years ago, I would then take off that part of the search and use, let me back up a second, I'll show you what terms I would pull up. I would pull up vertex baldness and coronary heart disease. And I would put coronary heart disease inside quotations as well, and see what kind of research has been done since this study was published. So that's part of what we mean by searching laterally. What do other sources have to say about it? And as you're looking at that, are there conflicting studies? Does anyone come out and say, well, actually, no, it's not. Or it's probably not the baldness itself, but baldness itself might have to do with high testosterone levels, and there may be a link between high testosterone and coronary heart disease, etc. Is there anything more recent? Yeah. And what else does that author write about? Let's see another example of that as we get a little further along. So that's what we mean by searching laterally. Don't just look at the article, interrogate the article itself, interrogate the topic to see if there's more out there that you don't find just by finding that one source. So I'd like to now at this point walk you through one of these kinds of questions. Just how would I approach it as a reference librarian, and some of the tools that you can use as you approach it to see, is there anything in this study that I'm finding? And the question I'm going to use is actually one I've used for a couple of other presentations. I heard an interesting idea the other day about using a helmet that emits infrared light as a way to stave off Alzheimer's. Okay. So it sounds kind of tinfoil hat-ish, but we'll see what happens. And sure enough, searching for, let me back up a second here, that phrase, those phrases, infrared light, helmet, in quotes, and the words stave off Alzheimer's. This is what I got. That's the title from 2008. And it's from a journal, an online journal called MedGadget. And there's the URL for it. I'm showing you a snapshot of the article. There are a number of things that are red flags here. So I want to illustrate that for you first. First off, MedGadget. Oh, sorry. MedGadget. It is a online journal for technology, not medicine. So they're going to be all excited about the gadgetry, the mechanics. They're not going to test the claims about whether this actually helps as well. Number one. The quotes that are given here, it's potentially life-changing, is quoted from the person, the inventor, who was director of his own research center. So, he's got kind of a vested interest in people believing him and accepting that. It reads like an infomercial. If you think you might lose your mind soon, continue trading your tinfoil hat for an infrared beaming helmet. And it's 15 years ago. It's a while back. Dr. Dougal claims that only 10 minutes under the hat a day is enough to have the effect. These are all important red flags. Would I tell somebody good to seek this out at this point as a reference librarian, not as a healthcare provider, not as a physician or a neurologist? I would say I'd be really wary of this and absolutely bring it up to your healthcare provider. It looks kind of sketchy. The claims that wearing it for 10 minutes every day bathes the brain with infrared light and stimulates the growth of brain cells. Come on, where's the research here? Okay. So I went looking laterally, searching laterally. I found this other news story that came out much more recently, 2021. Strange as it seems, a recent study found out that people with dementia perform better on cognitive tests. So they actually were doing research on people with this process after wearing helmets that emitted near infrared light twice a day for 6 minutes. And again, they're quoting from, here it's principal investigator Jason Huang, who's a neurosurgeon at Baylor Scott and White Health Center in Temple, Texas. They claim that the article was published February in the journal Aging and Disease. So that's what I would go to look for. I would check, and actually some of the people involved here are actually mentioned in the Med Gadget article, but we'll come back around to it again. But the biggest red flag is the journal citation is wrong. The journal Aging and Disease does exist, but the article didn't come out to July 2021. This was they claim it was published in February, and this came out in April of that year. So they were working off a press release or a preprint. The article had not been fully accepted for publication by that point, which means that the peer review process might not have gone all the way through. They may have had to make changes before it actually was published in the journal Aging and Disease. So that's a big red flag right there. But I went looking, okay, let's look at Aging and Disease Journal. And here's how I found that it was July 1st. It was published online. There's the title. Here we have Gordon Dougal, who is the person who was quoted in that Med Gadget article as the person running the center. There's Jason Huang, Marvin Berman. These are names we're going to see come back around again. When they say correspondence should be addressed to Jason Huang, so this is the person who is either the primary author or the person who is in charge of submitting it to the journal. So they're kind of the person in charge of this getting publishing. Looks like a perfectly good, on the face of it, what we see is a scholarly research report or a medical research report. But there's a bunch of more red flags. As you go through reading this, and I didn't copy it because it's lots and lots of fairly dense text, but here's what I found. One is that the peer review is questionable. And by questionable, I mean nowhere did it say in this article when it was submitted for peer review or when it was accepted by peer review. Peer review is an incredibly important QA for scientific research. An article is written, submitted to a journal, and the journal then sends it out to a bunch of peers. By this, they mean people who have some subject expertise in the topic. Theoretically, it's blinded, so they don't know who wrote it. They're not reacting to, oh, I know that guy, and he dropped his beer in my lap at a conference. No, they shouldn't know who has written it. They just read the study. And their job is not to say whether they agree or disagree. That has nothing to do with peer review. What peer review is quality assurance that their science was done right, that the methodology was accurate, that they didn't fudge the statistics. So for those of us who are not scientists, and I'm absolutely one of them, I rely on peer review to tell me whether the science was appropriate, was accurate, and the conclusions are reasonable based on the fact that they did a good study. So if I don't see proof that it was past peer review, that's a big thumbs down for me right off the bat. Also, as you read a little further, they use the phrase saying it's a proof of concept study. Oftentimes these studies will do very small groups to say, hey, is it worth doing a more extended, more expensive research study? Sometimes they call it a pilot project or a pilot study. Perfectly good science, perfectly worth publishing, but they only had 57 people. That's a way too small subset as opposed to the baldness one that we saw that was over 19,000. So it's much more likely to be statistically accurate. This is far too small a sample. And they only had mild to moderate dementia, if they even had a dementia diagnosis at all. That was not clear in this. As they were doing their treatment with the infrared helmet, they were doing standard cognitive tests, giving them tests to say, what's your cognition doing? And they improved a little bit over the course of a couple of weeks, but they didn't do any follow-up studies afterwards to see, did that effect stick with them? Or was that just a fleeting effect? And when they talk about how it improved the mood and the sleep habits of the person, of these people who either had dementia or were suspected to have dementia, they didn't actually do a sleep study or give them a test for mood. They just asked their caregivers, hey, were they less upset? Did they sleep better? Caregivers are marvelous observers. I'm not to discount them, but it was not a scientific study of that aspect. And yet they made the claim that it did improve. So overall, even though this is a scientific research paper just a couple of years ago, I see too many red flags in here to believe it based on this, just this, and the previous article. And when I do a Google search using infrared light helmet dementia, the very first thing that comes up is devices. You can buy your very own infrared light helmet for home treatment. These are not cheap. They're obviously, there to sell you a very expensive piece of equipment. Free shipping, yeah, fine, but I'm going to plunk it down somewhere between $250 and $500. I would want free shipping, but there's no proof that this actually works. And this goes back to a problem with asking Dr. Google, using Google to give you valid health information. Google prioritizes its search results to make money. The very first thing you're going to see at the top are ads, always. The next set of links that they find for you will be sponsored or paid. So again, these are advertisements. And sometimes you have to go to the second page of search results or even the third page of search results to actually get to information. So how many of us actually do that? Or we just see a couple handfuls of things on there and say, oh, fine, I'll just go with that one. And very few people, as studies show, actually go bother to look at the second or the third, much less any further down, except for librarians. We do that as part of our business. But that's a tool I want to suggest to you as well, is even if there is accuracy, even if you think this is a valid, perfectly reasonable way to treat or to stave off dementia, I should say, don't rely on the ones that are paid placements. They have a vested financial interest in you believing them. So some more lateral searches. Here's another one that I found this year, which is great. What is red light therapy and how does it work? The article is from a source called Healthline, which is a health news source. It was medically reviewed. Oftentimes, these health news sources have someone to review their pieces, their things that their journalists write. So Cynthia Cobb didn't write it, but Jacqueline Cafasso wrote it. But Cynthia Cobb looked at Jacqueline's writing to say, hey, are you making any claims here that are not good medicine? So there's some assurance there. But you notice the alphabet soup after Cynthia's name doesn't say MD, doesn't say that she's affiliated with any research institute. These, I went and looked them up because I didn't recognize FAANP or, maybe Flora might, but I didn't. These are all advanced nursing research degrees or certifications. So not to diss Cynthia Cobb at all, but is probably her knowledge of this topic probably doesn't come from an in-depth medical research study. So it actually is a pretty decent summary article I could think of, how it works, benefits, risks, where to go, FAQs, a summary. To summarize it for you, it mentions that there's been over 20 years of research, which we could see because that first article came out in 2008. And she did say that there's been some use for it in wound healing, and that was the first initial research, animal studies in rats with promoting hair growth and wound healing. It could maybe improve neural function or protect neural function, but more research is needed to support these claims. So based on her statement there, I would say I'm gonna stop there, just my judgment as a research librarian, and tell the person saying, hey, should I go out and buy one of these helmets? Better think more carefully and talk to your healthcare providers about that. But the other nice thing about this article is it also gives me other names for it. RLT, red light therapy, is different to a computer than infrared light. You can also call it soft laser therapy or cold laser therapy or biostimulation. Biostimulation is a broader term that refers to a number of different kinds of things. Or low power laser therapy. If this looked more promising, I might go back and do more lateral searches using those terms to find out a little bit more about it, to compile more evidence. But at this point, I think there's probably enough evidence to say, too many red flags, thumbs down, I'm going to trash it. So that's walking someone through that process. I hope that's illuminating to you, to give you an idea of how you might be able to do that for yourself. For those of you who are not familiar with how to read articles in medical journals or research articles, again, in our web pages on evaluating health information, there's one specifically on how to read a scientific journal and what to pay attention to, how to decipher what they're saying. So if your research takes you into one of these impenetrable looking articles, take a look at what we've got on our webpage and recommendations for how to read them and how to suss them out, even if you're not already a scientist. There are a handful of things I want to point out as being definite red flags, and I mentioned them in this example, but in general, these are some red flags. And the picture I have here actually is from a pumpkin carving Halloween exhibit in Monterey that was in conjunction with an information online searching conference, actually, that's happened many, many years, as the scariest things they could think of, and assuming that something causes something just because it correlates with the scariest thing that this person carving this pumpkin could come up with. So I thought that was cute. But always be skeptical of research with a small study size. And I would say if it's a very common health problem, you want to be in at least 6 digits of participants to have any kind of validity. Coronary disease, got to be in the thousands. Alzheimer's, I would ideally want to see research done on a much, much bigger group, because dementia, unfortunately, is far too prevalent. So, and we're not there yet. As one way of also looking at it, another magic phrase to look for is to say, have there been clinical trials? Clinical trials mean they're actually doing research on actual human beings. And it was interesting to find that as I did a little bit more lateral searching, I did see actually that there is already a clinical trial on using infrared light helmets with dementia or suspected dementia in Australia. And they're trying to put together a similar clinical trial here in the States, but it hasn't happened yet. If the studies have only been done on animals or in vitro studies, meaning cells in a petri dish, it may be promising research, it may pan out to be nothing. And a lot of the health news that's announced in various news media sources is promising new research study until you get to look and say, it's not human beings. I don't automatically trash it, but I'd say wait 20 years, unfortunately, before we actually have valid, significant research in human beings. Another buzz phrase to look for is there a control group? And this refers to the scientific method of, you don't just study people who exhibit whatever phenomenon it is that you're trying to study. you try to match them with a group of people who are as close, as much like that group as you possibly can in demographics, their age, their educational background, perhaps income background, if this is something that you think it might be a lifestyle related disease. And particularly race or ethnic origin, to see how prevalent is this, how diverse is this effect, and gender as well. You try to match a control group as closely to the group that you're studying that had that phenomenon, and then you could say, what's the difference between the two? Because if all you're saying is, in this group of people, it looks like this makes a difference, that's not enough. You need to find a control group to do that. And studies without a control group, automatic red flag. As I mentioned earlier, studies that have not been peer-reviewed, red flag. And we see this, unfortunately, a lot in the scientific literature because it's too easy a trap to fall into. But just because it correlates, just because it trends along with, it doesn't mean that it causes something. Human beings like to find patterns and find answers. And unfortunately, our brains are wired to go there, but that's not good science. Another thing to pay attention to is risk numbers, and this can get really tricky. So again, on that same page about deciphering health information and our evaluating health information webpage, and there should be a hyphen in there. Sorry about that. There's a section on understanding health risk numbers. Oftentimes they'll report results as saying that 1 in 10 of the people in this study, or 1 in 10 of people with whatever, but it doesn't actually talk about the absolute risk. An example that's given here is that, does a factor increase or decrease the absolute risk? If a new drug lowers the risk of a heart attack by 50%, huge win. But the absolute risk of heart attacks to start with in that group of people you studied was only 2%. That's 2 people out of 100. That means only 1 person less had a heart attack. This is why sample size matters. Obviously, you want your statistics to be as accurate as possible. But if you don't know that relative risk, you would just say, sign me up. Sure, I want to be one of that 50%. So there's an excellent video by 2 doctors that the National Center for Complementary and Integrative Health puts out that we've linked from this page that goes into more detail about what that means. But I encourage you to sort of stop and take a look at that. Some other key phrases or key things to look for when it's questions not about research necessarily, but are certainly not about theory, and you'll find a lot of theoretical stuff in the news, but on medical care, caring for people who have this condition right now. You want to look for these buzz phrases. Is it evidence-based practice? A lot of medicine, particularly before, I would say about 1950, talked about the art of diagnosing and the art of treatment. And certainly there is an art to that. But since then, there's been a revolution of healthcare. This really showed up in the medical schools in the 1980s and 90s. So in the 1990s, when I was working for a teaching hospital, I spent a lot of time teaching the medical students there how to look for evidence-based results or evidence-based research. Is there scientific proof behind it that says this really works? And there is a source that is considered to be one of the best ones to report on evidence-based practice, and that's called the Cochrane Reviews. So if you happen to find an article that summarizes a Cochrane Review, that's kind of the gold standard. Another thing you want to look for, if you can't find evidence-based practice or standards of care, is another major phrase that's used for that. If this is a little too new, has there been comparative research? And key phrases there is a meta-analysis or a systemic review or comparative study where they're comparing several different research studies. So it's not doing one research study, but looking over many different ones to see what the differences might be. Another buzzword phrase to definitely look for when it comes to caring for people is what's best practice. So that, along with the one I didn't put in there, which is standard of care, are definitely things to look for. especially if you think that someone is not being treated adequately or not getting as much care as they should have. These are things to look for. And again, there's a website for where you can find more about these things. It's after we're closing to end up, so I'm just going to leave this here, but to say that we're seeing now in the last couple of years, more and more chat GPT used to generate patient information, handouts. It's not that it's bad, it's a useful tool for summarizing a lot of information, but it's not intelligence. It's not artificial intelligence. What it's looking at is, does this word tend to come close to that word? And those of you who have seen maybe your email client, finishes phrases for you, or and then you say, wait, I don't want that word. I want this other word instead. That's really what they're looking for, is do these words come close to each other? And unfortunately, right now, Chat GPT tends to what the technology folks refer to as hallucinate. They'll just go way off into some other word that doesn't make any sense. So unless a human expert reviews something that was created with Chat GPT, definitely trash it. So, and there are telemedicine chatbots out there like Online Help, for those of you who've seen that, with these preset text responses. Again, make sure that you can get to somewhere that it adequately comes down to the specifics of what you're looking for. And that may be a human being. The one thing that AI is good for, and is showing up to be really important, is it can be better than humans in diagnosing some things. But that's not across the board yet. But there's some really useful tools out there for that. And then I always want to finish with this warning as I'm talking about this topic, that always keep in mind that even if you find completely accurate, completely verified, relevant information, it may not apply to each individual person, because people are tremendously diverse and medicine is very complex. So always, always, always bring back these health concerns to your or to your loved one's healthcare team and ask them, does this information, is it correct for me, or is it correct for them, or is it relevant for me or them? Because it may actually, your situation or their situation may be actually very different. So don't diagnose yourself. That's one of the fallacies to fall into. And I'm going to stop there. We have some minutes, at least 5 minutes, I think, left for questions and chat. So talked a little bit more this time than last time. If you have questions that you want to direct to me directly, there's my voicemail number. Oops, I forgot. It's 408 area code. Just actually fix that. I'm going to put that in there and I'll come on back. There we go. There, that's my accurate phone number for the voicemail. And there's my email. But I want to see if there were any
Thank you,
questions
Lise.
that came up.
Yeah, I'm
Yep,
going to
go
go
for
to
it, Flora.
Sarita. I'm going to go to Sarita, who's got the question she's managing in the chat in a second. Once again, I want to thank you. I've got 3 pearls of wisdom that I have gained from your speech today. So the first is that it's very clear to me that the PlaneTree agenda has to do with the sharing of knowledge, because that knowledge is power. That knowledge and power is the advocacy we all need. And I thank you for that. You've helped us to understand how important it is to decipher medical word salad. And being someone
Right.
who isn't articulate in all aspects of healthcare, that's very important. Because when family and friends ask me something, if it's not an area of my expertise, I frequently say, not in my wheelhouse, but helping people to decipher that is really important. Sarita, what questions have come from our audience?
Well, so far I'm seeing one question here, and person that says that I understand that some medications may be used for more than one condition. How do we research the secondary use of the treatment or the drug? Do you have any tips for that?
Sure. Yeah, that was something that came up actually in last week's program. It's what's called in the health literature off-label use, that once a drug has been approved by the FDA as safe to use on humans, or safe enough, then physicians are free to prescribe it for anything that they think might be relevant for it, including things that have nothing to do with them, to do with the original approval. So searching that phrase, off-label, along with the generic name of the drug, is a good way to find out what those uses might be.
And certainly
That's where I think.
go
Oh, go
Lise.
ahead.
Well,
And
I
that's
think
where I
right,
would start
go
out with a
first.
simple Google search using the phrase in quotes off label and then the generic name of the drug and see what comes up. And if anything shows up from Medline Plus, then I'd definitely trust it. Sorry, Flora, off you go.
No, that's okay. I was going to say a perfect example of that is something we're seeing all across the multiple media sites now, and that is using Ozempic, a diabetic medication for weight loss. Yes, it can cause weight loss in diabetics, but the rise of it being used in non-diabetics is certainly one of those categories of off-label. So,
Yep.
Sarita, do you have any other questions? I have one that's come through my end of the world.
Take it away, Flora.
Okay, thanks, Sarita. One of the things I'm the most impressed with, obviously, is PlaneTree. Are there other services at the PlaneTree Library that people can access? And how do we become a member? Because I think it's a great place for me to raise my hand and say, what can I do?
We'd love to have you, Flora, as a volunteer. Thank you. You don't have to have a membership. All of the information we put up online, all the links that we put up online is open to anybody who can find it online. So you don't have to join or create a membership. And that's because the resources that we put in, not only do we verify that they are accurate, but they're also free. We want to make sure that anything that we put up on our website is not behind a paywall. So then we don't have to pay for somebody else accessing it. What you can do, and the general public is welcome to do this, is to contact me directly. Email is preferable, actually, so that I can get the spelling of things. If you have a reference question, if you have a concern, about information that you're being told or having trouble understanding something, what you could do as a volunteer, there are lots of possible things. We're always looking for people to help with our review of these websites, people who have the background. And so with your nursing background, for example, Flora, we'd love to have you to help curate these websites. But some of the other things people can do are help with manage our online directory of pre-open public health events that are online. We keep a community calendar going for that. And there's other projects like that that we would love to have volunteers help us with. So you don't have to be based in California. You don't have to be based in Santa Clara County in California. If you have some time and some interest, since we are all online, we'd love to have you. And just feel free to email me and say, hey, I'm interested. Here's my background. What can I do?
It's great information because one of the things we know at AARP is that our members are more often than not ready to raise their hand to share their knowledge and expertise with their communities. And this is one way. Sarita, looks like another question came in from the
Yes,
chat.
and this one is for Lise. The question is, are there other PlaneTree Health Libraries across the country?
There are, but so PlaneTree actually started out in the early 80s as part of the trend towards what they call patient-centered care in hospitals primarily, which is to say that the patients have a more say in what their treatment might be and what their preferred outcomes would be than simply leaving it up to the medical professionals. As you can imagine, that's an important trend to head towards. And in those days, most of this health information was not available to individuals. It wasn't up online. There wasn't an online yet. And the access to the journals was limited because they're extremely expensive. I was saying earlier that I had major sticker shock in 1996 when the 1 year's subscription for journals for a small community hospital library was the same as the purchase price of a house 15 years earlier. And it's only gotten worse. So there's a difficulty in individuals getting information about their healthcare if they're not already connected with a healthcare system. That's how the libraries for PlaneTree system, PlaneTree International, which is the parent organization, were started. There are other PlaneTree libraries out there, but ours is the only one that is not affiliated with a hospital or healthcare system. All of the others are managed as an adjunct to a hospital library or to a research library at a medical center. So we're unique in that respect, but there are other PlaneTrees. There are other libraries that do similar work. Stanford Hospital has a similar library that is, they were closed during the pandemic, but they're back online again. Although I think they may limit their services to people who live in their service area, which is the Bay Area. I don't know if they will do a broader reference intakes. We're kind of unique in that respect, that we will answer queries from anywhere and anywhere.
Well, thank you so much today. These 2 weeks have been quite enlightening for me, and being someone in the healthcare world originally, but now in the everyday world, and I value very much your knowledge. So before we close out today, there are some other resources that we want to share, and that has to do with research, not only in general, but specific for caregiving. We know that our members are very concerned about their role in caregiving, whether they are the caregiver or they have the blessing of having a caregiver. We have this dedicated toll family line, and it's very valuable. And so I encourage everyone to use it. And I'm going to close out again, say thank you to Lise, and turn it over to Sophie. Sophie, you're on mute. Oh, we've lost Sophie's voice. Okay.
Okay. Thank you, Sophie, for the laryngitis response.
Okay, I'm going to say, on behalf of Sophie, I'm going to say thank you to everyone. This concludes today's program. Please look out for the email that will follow up with a link for all the resources that Lise mentioned. Thank you all, and keep watching and listening to us as we have further educational environments.